Welcome to the training for healthcare professionals. Let's begin with the module which focuses on intramuscular injection. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to explain what is intramuscular IM injection administration, select a site for giving IM injection, give an IM injection. Now let's understand what we mean by IM route. It is a route in which medicine is injected into a muscle which encourages rapid transport of medication through the bloodstream. It is one of the several methods of drug administration. The most common use of IM injection is to give vaccines. Here are the most common sites for IM injections. Deltoid is a muscle of the arm. Dorsal gluteal is the buttock muscle. Vastus lateralis, this is the muscle in the lower end of the thigh. Rectus femoris is the middle of the front of the thigh. Now let's see when and why IM injection is given. An IM injection is given to administer small amounts of medicines. Medicine is absorbed quickly if given intramuscularly. Some medicines may not work if taken by the mouth and may work faster if taken through the IM route. Some medicines may be given through the IM route if the patient is unable to take them by the mouth. IM injections are given to pediatric and adult patients. Some examples of medicines given using an IM injection are certain antibiotics, certain contraceptive hormones, most vaccines, epinephrine injections for severe allergic reactions. Now let's take a look at the parts of a syringe commonly used for IM injections. A needle syringe is a device used for injecting, removing, or infusing fluids. Syringes can differ in size and type. A syringe has the following parts as shown. Plunger, to fill or empty the barrel. Barrel, to hold the medication, blood, or fluid. Needle, to prick the site to inject the medication. Cap, to cover the sharp end of the needle. For an IM injection, the needle needs to be long enough to ensure that the medicine is injected into the muscle. A 22 to 24 gauge needle is preferable and suitable for all ages. 21 or 22 gauge needles are smaller and are only recommended for children. Here are the items that we need to administer an IM injection. 1. 1 alcohol wipe. 2. 1 sterile 2x2 gauze pad. 3. 2 needles, one to draw medicine and another to inject. 4. A vaccine ampoule or vials. If the vial has medicine in the powder form, then sterile water or saline is needed for dilution. 5. Disposable gloves. 6. Sharp box. Now let's take a look at the procedure to administer an IM injection. 1. First, ensure patient privacy as appropriate. 2. Then verify and confirm the patient's identity. 3. Introduce yourself and state what you will be doing. 4. Explain the procedure and position the patient properly. 5. Wash your hands and wear gloves. 6. Check the medicine for correctness and expiry date. Check rights of medication. 7. Draw up medication from the vial. In the case of an antibiotic injection, give intradermal test dose of medicine to check for allergic reactions. Dispose the needle after drawing the medicine. Now for administering IM injection. 1. First, select the site. 2. Clean the site with alcohol wipe and air dry. 3. Hold the syringe with the new needle between your thumb and forefinger. 4. Hold taut the skin around the site. 5. Insert the needle into the muscle at a 90-degree angle. 6. Pull the plunger out to see if a vein has been hit. If blood is noticed, withdraw the needle and start afresh. 7. With the new injection, slowly inject again and push the plunger to administer the medicine. 1. Once the medicine is injected, remove the needle at the same angle as it went in. 2. Place gauze and press in circular movement over the area where you gave the injection. 3. Monitor the pulse of the patient. 4. Dispose of needles in sharps and other items such as gloves and syringe in the correct waste disposal bin. You should always record all information concerning the patient and medication, including indication for drug administration, medicine name, batch number and expiry date, site, dosage and route delivered, patient response to the medication, both positive and negative effects or side effects. You must inform the doctor in case you observe any of the following. A fever, sneezing or coughing develops after the injection. There is a lump, a swelling or bruising where the injection was given that does not go away. A rash or itching develops after the injection is given. Shortness of breath develops after the injection is given. The mouth, lips or face swells after the injection is given. Now let us see a demonstration on administering IM injection.
In this episode of Tomorrow's Clinicians, we'll be looking at the procedure of administering an intramuscular injection using the Z-track technique. An intramuscular injection deposits medication into well-perfused muscle tissue. The vascularity of muscle aids a rapid absorption of the medication into the systemic circulation. Intramuscular injections are used to deliver medications that would otherwise be absorbed too slowly or made ineffective if taken orally, when intravenous access is difficult, or if other routes are contraindicated. The intramuscular route should not be used in cases where muscle size and condition is not adequate to support sufficient uptake of the drug. Intramuscular injections are of limited use in patients who have impaired peripheral circulation and edema. Intramuscular injections should be avoided where possible in patients with thrombocytopenia or impaired clotting. Examples of medications delivered via the intramuscular route include analgesia, sedatives and antiemetics, some antibiotics, some contraceptive hormones, most vaccines, epinephrine or adrenaline injections for people with severe allergic reactions. To perform an intramuscular injection, you'll require the following equipment: a completed prescription, a syringe containing the prepared medication that has been checked, a 23-gauge needle. The length depends on the size of the patient, an alcohol-based cleansing wipe, gauze, a suitable dressing or small plaster, and a sharps bin and tray. Before visiting the patient and beginning the procedure, you should wash your hands. Ensure the area where the procedure is to be undertaken is adequately lit, clean, safe, and that the necessary equipment is available. It is important to ensure you've identified the correct patient. Confirm the patient's identity verbally by asking them to tell you their name, date of birth and the first line of their address. If the procedure is performed on an inpatient, also check the patient's wristband to verify their patient identification number. Check whether the patient requires a chaperone or interpreter to support them. Briefly explain the procedure and gain informed consent verbally. Now select the site for injection. This must be considered carefully, taking into account the patient and the drug to be administered. Certain muscles are recommended for intramuscular injections. These sites include the deltoid muscle, the vastus lateralis muscle, the ventrogluteal region, the dorsogluteal region, the rectus femoris muscle. In this film we will look at an injection into the deltoid muscle. The volume of liquid injected into the deltoid muscle should be limited to 1 milliliter. Larger volumes can be delivered to other sites. Refer to your local guidelines and classroom teaching for further information. Position the patient comfortably and expose the appropriate site for injection. Avoid areas that are painful, swollen, or show any skin erythema or breakdown. Skin lesions, birthmarks, moles and scar tissue must also be avoided. You're now ready to prepare the items you'll be using. Check the prescription and prepare the medication if required, as shown in the Making Up Drugs for Parenteral Administration film. Ensure that the appropriate checks have taken place. Attach the needle to the syringe containing the medication if required. Gather the equipment and prepared medication or pre-filled syringe in a clean tray and take this over to the patient. Clean your hands and put on a clean apron. Position the patient and put on a pair of non-sterile gloves. The deltoid muscle is located laterally on the upper arm. To emphasise the contour of the deltoid, ask the patient to place their hand on their hip, which abducts the shoulder and flexes the elbow. The bulk of the muscle lies from the lower edge of the acromial process to the midpoint on the lateral aspect of the arm in a line with the axilla. The intramuscular injection is given approximately 4 to 5 centimeters or 2 to 3 fingers width below the acromial process. Clean the intended injection site with an alcohol-based skin cleansing wipe and leave to dry for 30 seconds. Remove the sheath from the needle. Using your non-dominant hand, pull the skin away from the intended site, moving the cutaneous and subcutaneous tissue by approximately 1 to 2 centimeters. Hold the syringe in your dominant hand like a pen and insert the needle into the skin at a 90-degree angle, ensuring that 1/3 of the needle is left outside. Aspirate the needle, observing for blood return. If this occurs, it means that the needle is in a blood vessel. Withdraw the needle, discard the syringe and restart the procedure. If no blood is aspirated, inject the drug slowly into the selected muscle at a rate of 1 milliliter per 10 seconds. Once the medication has been given, remove your finger from the skin surface, allowing the layers to return to the original position, trapping the drug. Withdraw the needle from the skin and discard the syringe and needle into a sharp spin immediately. Apply gentle pressure over the injection site using gauze. Check the injection site for excessive bleeding or localized skin reaction. Apply a dressing if necessary. Vaccinations are not given using the Z-track technique. The procedure of administering a vaccination is covered in another film in the Tomorrow's Clinician series. Dispose of waste in a clinical waste bin, remove your gloves and apron and clean your hands. Document the administration on the patient's prescription chart or in their notes and ensure the patient is comfortable. Observe for any adverse drug reactions. I hope that this film has given you an insight into the procedure of administering an intramuscular injection. Please remember that this film has been produced as a guide in order to demonstrate the principles behind this procedure and must always be used in conjunction with your own classroom training and local guidelines.
Always remember to complete your documentation after the procedure is done. Please note down the following points regarding IM injections. Follow proper patient identification procedures. Follow correct needle insertion technique. Pull back on the plunger a little to make sure you did not hit a blood vessel. Do not inject the medicine if blood is drawn into the syringe. Dispose of both the syringe and the medicine if blood is present. Get more of the same medicine in a new syringe. When you give the second injection, give it on the other side or at a different site.